welcome to the Stroke Recovery Group. I'm so glad you're here. Hi everyone, welcome back to the I Care for Your Brain Stroke Recovery Group, brought to you by the Foundation of First Health. What we're going to talk about today is our fourth rule of rehab. If you were with us last time, we went through rule number 3. This was focusing on repetition and consistency. I hope that if you were with us for that session, you were enlightened about how much hard work has to go into your recovery, but also how much serious rest. Remember, we're always trying to provide an enriched environment to the person with a stroke, which means very high quality repetition, cognitively complex rehab and engagement, but we have to balance that with a lot of high quality rest. So let me just do a brief recap of rule number 3. Consistent repetition is the most important part of recovering from any type of a stroke. Scientific studies tell us that when there is enough repetition over time, that there are long-term significant improvements in the connections between brain cells. I want you to concentrate on the number of repetitions per therapy session, not just the number of time you spend doing it. Brain scientists know that the time immediately following an intense rehab session is just as important as the therapy. So it's very important that you make good choices about what you do after an intense therapy session. We talked about things like the importance of resting, briefly napping, deep breathing, listening to music. We also went through the concept of neurofatigue, which is probably something that you've been dealing with since you've had your stroke. We talked about what it is, why it happens, and different strategies for trying to reduce its impact on your recovery. Repetition is the fuel of neuroplasticity, and consistency is what keeps it going. We talked about a move in rehabilitation towards something we call intensive massed practice. And what that means is we need to do a lot more repetitions of therapy than we're doing right now in traditional outpatient therapy sessions. Most outpatient therapy sessions, unfortunately, do not have enough repetitions to result in the best outcome for you and your family. You are going to have to do the hard work of therapy to have the very best outcome. In rule number 3, I also encouraged you to celebrate your victories big and small. It's very important that you fine-tune your eye to even the smallest improvements. Stroke recovery is a marathon, it's not a sprint. And I want you to celebrate all of the victories that you can see as you move through this recovery. And I want you to do that with something that is special to you. So now we're going to move into rule number 4. This one's actually pretty fun. We're going to talk about how to harness your creative power. This one really focuses on using creativity and the power of your thoughts to enhance your recovery. I want you to really listen closely to this rule if any of the following apply to you. I want you to be concerned if your rehab doesn't feel like it has much joy to it, if it feels a little bit like drudgery and that you're just going through the motions. If you often find yourself thinking about what you can't do, if you feel bored by the therapies, if most of your conversations revolve around the stroke, if most of your social activity involves medical appointments, going to doctors, and if you haven't felt a sense of awe or wonder in recent memory. So how is it that we can breathe new vibrancy into your recovery and make it more enjoyable? This is where we can get creative. Creativity promotes neuroplasticity. Creative action after a stroke leads to a physical strengthening between the brain cells. That's neuroplasticity. That's what we're after this whole time. Different types of art stimulate different parts of the brain, and these stimulations enhance neuroplasticity. So I want you to think about it like this. Art and creative activity is a bridge. It's a bridge that can connect you to yourself. It's a bridge that can connect you to your emotions, the human experience, the stroke experience, and to other people. Arts-based rehabilitation stimulates the brain through all the senses and can create a safe environment for self-expression and encourages communication. There has been a lot of research in recent years about the power of art therapy and stroke recovery, and I wanted to just share one of those research studies with you. There was a study in 2016 out of Japan in which they looked at the efficacy, the power to change stroke outcome following creative art therapy. And what they did is they had two groups of recent stroke survivors who were in the inpatient setting, about 118 of them. And what they did is they offered one group traditional physical therapy, and they offered the other group physical therapy plus art therapy. So what they did is they interviewed each group of patients after to see what their experience was. And I want to tell you a little bit about their findings. There were definitely differences between the intervention group, which was the creative add-on therapy group, that were significantly greater than the control group who just got the physical therapy in things like depression, physical functioning, and quality of life. When they asked people in a questionnaire after, 69% who were in the art group said that they felt that it improved their concentration. 80% reported that it felt like it improved their emotions, their emotional state of mind. 74% said that they felt improved motivation to participate in all their therapies. And 72% of them reported increased self-confidence. Who doesn't want all of that good stuff? And what I want to emphasize to you is that you don't need to be an artist. I hear that oftentimes from my patients. Well, I'm not an artist. I'm not creative. I'm not a musician. It really doesn't matter. You don't have to be musical or artistic to benefit from art therapy. Creative therapies are so important in stroke recovery because we take the focus off the physical self and we can incorporate more of a whole body approach to stroke recovery. It's nonverbal, symbolic communication that allows us to express the complexity and the emotions and feelings of a stroke recovery. Creativity promotes healing and quality of life. Simple. The key is to finding a creative activity that works for you and feels good to the point where you're going to want to keep up with it. Each creative approach has its own advantages, but there's 4 things that hold it all together in terms of benefits for you and your brain. The first one is that it's unique brain stimulation. Art is very colorful oftentimes. It is unique. It brings together disparate elements that create something new and exciting. When we look at art, all different parts of our brain are lighting up and becoming engaged, and the different parts of the brain have to integrate all of the different elements of the artistic piece. It also helps us feel good, and this isn't just a feeling. We are releasing feel-good chemicals in the brain that promote healing. This is very important that we have a calm, relaxed nervous system as we go through your recovery. Creativity can also help us think of different ways to solve problems. It is a different approach to getting to the end point. And oftentimes when we see other people approach problems creatively, we kind of absorb that ourselves. And the last piece is that it can give us a feeling of control or mastery. And I think that that's very important. I think it's difficult for the human spirit to constantly feel like it's fighting an uphill battle. And oftentimes art can just make us feel like I can just focus on this in the here and now. It can give us a sense of being in control of what's going on in our lives. Creativity can come in many, many different forms. Things like coloring books have become very popular in the last few years. Singing, even if you're tone deaf, it really doesn't matter. Things like sewing, music, designing cards, painting, drawing, collage. But even if you don't want to do something that's creative, you can really just sit back and take it in. Even just art appreciation has been shown to be highly therapeutic to the brain. But sometimes when I make those suggestions, I worry that if some of you out there aren't able to do those things in full like you did before, you might be hesitant to try. And that would really be a big mistake. So I want you to meet your recovery where it is. It's okay to adapt any one of those things I just recommended to your ability level at this time. So what I want to share with you now are 8 creative powerhouses for the brain that are scientifically evidenced to support you in this recovery journey. The first one we've talked about a little bit before, but it's so powerful we have to bring it back in, and this is music. Music is special in that it can both activate us when we need to be a little bit more up and on, but it can also soothe us in our brain and our nervous system. After any type of brain injury, it really has a lot of research base for supporting recovery. Research suggests that the most therapeutic music for all of us after a brain injury are the songs and the melodies that were meaningful to us in our younger years, teenage to about age 21. I think that's really interesting. Those melodies and those songs are so deeply connected to our emotions and our independence and our sense of becoming our own person that they really stick in the brain for quite a long time. Music really activates the emotional center of the brain, the limbic system, and this can give an extra boost to the thinking parts of the brain, especially in areas that control language. If any of you are struggling with aphasia as you go through the stroke recovery, try singing. You might amaze yourself with how well and fluently those words and lyrics can come out of your mouth. The next one is dance. Dance has gotten a lot of media attention in the last few years as being the ultimate exercise for the brain. And after some more digging around, what I realized is the real benefit is doing something that's both physical and cognitive at the same time. Of course, dance can increase our flexibility, it can increase muscle strength and tone, endurance, balance, spatial awareness, and all those things are very important, especially if you've had a stroke that impacts your cerebellum, any part of your brain that's involved with balance. But dance movements are also very powerful because of the cognitive piece of trying to learn a step, remember it, and make your body go through those steps in order. So again, with the idea of meeting your recovery exactly where it is, incorporating dance into your rehab can occur across a wide spectrum. Sure, you can go and try to learn a new style, maybe ballroom dance. You can tap your foot to the bass, or even someone who has a significant issue, maybe like a locked-in syndrome, you can even ask the person to open and close their eyes to the beat of a song. Another really powerful creative activity you can bring into your recovery is writing. Writing is an excellent way to get your thoughts and your feelings out of here and get it outside of yourself. You can use fill-in-the-blank style workbooks. We have some of those in the Stroke Recovery Guide. You can write a poem, you can tell your story. What's really important is that you put your heart and soul into those words, really trying to move the experience from within you outside of yourself. There's been some research showing that people who are able to blog after a stroke report that they feel that they were able to find a new identity. This was especially true that people who struggled with expressive language issues like expressive aphasia. Unexpressed emotions can really fester in us, weigh us down with muscle tension, and take up very precious brain real estate that you need to focus on your recovery and joining back into life with the things you're dealing with now. The next one is cooking. This is really a special one. Cooking offers so much brain stimulation and connects us to our humanness and our identity beyond a stroke. There's been some scientific writings that focus on the disconnection that can happen to people after brain injury with their food. This is a big part of why we think institutional care is difficult for people. They're not really involved with the preparation of their food anymore. So I want you to really try to be involved. Help your loved one really be involved with the food that they are eating. And this can range from anywhere from being a part of the action with adaptive tools to directing the action from across the room, tearing lettuce, being a taste tester. All of this stuff is really important. Even if someone is just present when foods are being cooked and they are able to smell all of the different things that are happening in the kitchen, we know that this can really aid in recovery. It can also really be a part of developing healthier eating habits after a stroke, which are really, really critical. There is one diet that we support very much called the MIND diet, the Mediterranean Intervention for Neurodegenerative Delay. That's quite a mouthful, but we have details about that and even a food tracker that we offer in the Stroke Recovery Guide that you have access to as a part of the Stroke Recovery Program, where we describe that diet in detail. It's the only diet that has scientific support to reduce cognitive decline after a stroke. I want you to also think about bringing something creative into your world that is both repetitive and calming. This can be anything from prayer to calming music to nature sounds to guided meditation. It's very important that every day you make time to be quiet and centered. This is going to help you stay focused on what's important and help you let go of the daily stresses that happen in life to all of us. Taking this time to pause and reflect will also help you integrate the big picture of your stroke recovery and also fine-tune your mind to those little recoveries that are happening all the time. What I'm afraid of is if you don't focus on the small things that are happening positively for you in this stroke recovery, you might get discouraged, and we don't want that for you. We want you to stay with a positive mindset. Meditation has been independently associated with a lower prevalence of high cholesterol, hypertension, high blood pressure, diabetes, stroke, and coronary artery disease compared to those who don't meditate. And those are all very strong risk factors for having a first stroke or a second stroke. 2 weeks of mindfulness meditation has also been shown to improve post-stroke spasticity. I thought this was an important quote to include for those of you who might still not be totally convinced that this is something you should spend your time doing. This is from Jon Kabat-Zinn, and he says, as long as you are breathing, then there is more right with you than is wrong with you, no matter what is wrong. So no matter where you are in the stroke recovery journey, it's very important that you respect the importance of the downtime just as much as you respect the hard work of rehab. There's also some really interesting research about the power of mental imagery, and this is really important for those of you who are struggling with some of the more significant symptoms that can happen after a stroke, like loss of an arm or even a whole side of your body. Research has shown us that the areas stimulated during the imagining of a movement are the same as those activated during the actual performance of the task. How interesting is that? So what that means is in your mind's eye, if you can imagine, let's just say your left arm that in real life is not working very well right now, but if you could imagine your arm moving all around freely, hitting a tennis ball with a tennis racket, the same parts of your brain are going to be stimulated as if you were really doing that in real life. And that is so important to neuroplasticity because of the use it or lose it principle that we've talked about. So what this means is that mental practice alone is a form of rehabilitation therapy. And this is very important for any of you who are perhaps done with your insurance-based rehabilitation and feel like you need more. Just imagining yourself doing exercises in your mind is actually a very powerful intervention. Research has shown that mental practice in combination with other therapies is more effective in improving upper extremity function than just the other treatment alone. So what this means is this is a great adjunct therapy. This is something that as you're doing your PT, your OT, your speech, if you imagine yourself doing it, you're really giving your recovery a power boost. So even if you can't do something in real life, please imagine yourself doing these tasks in as realistic a way as you possibly can to rebuild those brain networks. Remember before I said you don't even have to participate in a creative activity to get the benefits. Art appreciation, just looking at beautifully aesthetic things, is also very powerful for your brain recovery. Engaging in regular visual arts intervention has been proven to facilitate spatial improvement and something we call functional connectivity of the brain. And all that means is different brain cells in different parts of the brain spread across space are reaching out to each other to try to communicate, to process what our brain is seeing. This is pretty amazing. And it's been associated with the increase of psychological resilience in adults. And that's something that we significantly need, and we're going to be talking about in a future rule. And what that really means is how is it that we can stay and build on emotional strength as we move through this recovery? The next one is talking about something called Mirrorbox Therapy, and if you haven't heard of this yet, I'm very excited to introduce it to you because it is a very low-risk, low-cost intervention that is very powerful. There's strong research for the use of Mirrorbox therapy with hemiparesis, so difficulty using a hand or a leg, and pain syndromes that can occur at all stages of stroke recovery. It's been shown to improve the use of an affected hand, especially grasp and dexterity, so imagine kind of picking something up, speed with which you can use your hand, and overall range of motion. And what's really powerful about Mirrorbox therapy is it isn't just therapeutic when you're using it. There's been evidence that it also benefits you in everyday life up to 3 months after you've used Mirrorbox therapy. So what is this Mirrorbox therapy? It really is a little bit of magic, but what we're doing is exploiting the concept of visual illusion in the brain. It creates the illusion that an affected limb is moving effortlessly. The visual feedback from the mirror of the intact limb in place of the injured limb tricks the brain into thinking that the limb is working perfectly. This therapy is based on the belief that every time the person moves the affected limb in the mirror, the brain receives visual feedback that the limb has regained function. Over time, this therapy helps the brain to rebuild the brain networks connecting limb to brain. I'm going to show you a picture of the Mirrorbox in a minute so I can explain it in a little bit more detail. But I want to let you know about the research that supports Mirrorbox therapy. It has been shown to improve strength, speed, walking, length of stride as we walk, balance, and pinch grip, picking up little things with our fingers. Again, it is found to work best when combined with conventional physical or occupational therapy. So this is something you can buy on your own. They're typically $40 or $50. Have it in your home, and you can use it as you're also participating in your traditional rehabilitations. The session length should be increased gradually. You can start off by just doing 5 or 10 minutes. Optimally, you want to try to get in about 30 to 45 minutes a day. And the effects seem to last about 3 months. That's pretty powerful. It's discomfort-free. It can be done without supervision and can be repeated without any type of physical strain. We're going to talk about that in the handout for this session. So let me show you a picture of a Mirrorbox. I recommend the Edge Mobility System Mirrorbox. You can use this link I have at the bottom here to get 10% off. So you can see what happens when you look in that mirror is that you have the illusion of having 2 working hands. What you want to do is just look in the mirror and move your working hand in all sorts of ways. You can do thumb to finger slowly, you can move it up, you can move it down, you can put a therapy ball in there, anything to stimulate the brain and basically trick it into thinking that the affected limb has come back. A creative approach to stroke recovery improves things like cognition, physical impairments, the immune system, quality of life, self-confidence, anxiety, depression, blood pressure, social isolation, and stress. So who doesn't want more support in those areas? When you are engaging in creative things, when you look at creative things, you're really giving yourself a gift, and I want you to readily accept that gift. Recovery is not just about your physical self. Remember, we're taking a whole person approach to the stroke recovery. It must also include your emotional self and your spiritual self. Creative activities can provide you with a great sense of spontaneity, playfulness, joy, peace, awe, and again, that connection that we so desperately need to ourselves, to other people in the world. So the question that we come to after this rule is, do we want to be in the stroke survivor camp, or do we want to be in the stroke thriver camp? And I believe strongly that creativity can help you go in the thriver direction. So we're going to end with our self-empowerment statement for this rule, which is, I will thrive in my recovery by embracing creativity. I hope that you guys will join us next time for rule number 5, where we're going to talk all about the importance of prioritizing your sleep after a stroke. Thank you guys so much, and I'll see you next time. Bye-bye.